Okay, we're going to make a start, everybody. So welcome to this morning's breakfast session titled The Built Environment and Health, Connecting Research to Practice, hosted by Vic Health. For those of you that I haven't had the pleasure of meeting, call Michelle Murray Tukuingwa. My name's Michelle and I'm the Executive Manager for the Health Promotion Systems at Vic Health. So I'd firstly like to start off by acknowledging country. So on behalf of Vic Health, our speakers and attendees, I'd like to begin by acknowledging the traditional custodians of the land we're meeting on today. We are on the Wurundjeri Woi Wurrung, people of the Kulin Nation, and I pay my respects to elders past, present and emerging. As we come together to discuss healthy environments, I acknowledge the wisdom of the traditional custodians and the enduring legacy of their contribution to the land. How our cities, towns and neighbourhoods are designed and developed has a direct and lasting impact on our lives and the health and well-being of our communities. The connection has been demonstrated through decades of research and evidence, and there is a major potential to use this research and evidence to inform contemporary and innovative health promotion efforts. That's why Vic Health focuses on neighbourhood and built systems within the 10-year strategy released in mid-23. We aim to create positive change where Victorians live, connect, play, travel, create and work. Through this strategy, Vic Health will work with communities, partners and experts to improve health outcomes through more equitable use of neighbourhood spaces, such as sports facilities and schools. We also seek to influence how decision makers consider health within the planning and design of the built environment. We will use research to inform our approach and partnerships to leading increased physical activity, improve social connectedness and reduce systemic discrimination and racism. We will also help to shape and share knowledge and research to inform and influence strategies and policies to make a difference for those that face more significant structural barriers to health and wellbeing. So today we have brought together 4 experts to explore the nexus of urban planning, the built environment and public health within the context of the World Health Summit. Our presenters will discuss how we can bridge the gap between knowledge and action, between ideas and implementation being very important. This morning we also want to hear from you and learn from you to inform our healthy neighbourhoods and built systems work and approach. So you'll see the QR code on the screen if you wouldn't mind just scanning that, and we'll take you to a Slido that introduces 2 questions. But just to let you know, we'll summarise this information and share that with you after the event today. So question 1. How can we ensure that efforts to improve health through changes in the built environment are equitable and fair, enabling health for all members of our communities? And then we have question 2. What practical steps can we take to translate research into policies and actions that address disparities in access to healthy living environments? So our session includes a keynote presentation from Salvatore Fundaro from the UN Habitat. This will be followed by a panel discussion featuring distinguished Professor Billy Giles Corte, Dr. Jonathan Spear, the CEO of Infrastructure Victoria, and distinguished Professor Anna Timperio. So I'd first of all like to introduce our panel members, and if you could join me on the stage, that would be great. So first of all, we've got Salvatore Fundaro, is an urban planning and design expert and program manager at UN Habitat. Salvatore has over 20 years of experience in architecture, urban planning and design, developed both in the public and private sectors. UN Habitat's role is to promote transformative change in cities and human settlements through knowledge, policy advice, technical assistance and collaborative action to leave no one and no place behind. Salvatore will share the recently released UN Habitat My Neighbourhood report, which outlines critical urban design principles applicable in diverse cultural and geographical contexts at the neighbourhood scale. Secondly, we have our distinguished Professor Billy Giles Corte, who is a Vice-Chancellor's Professional Fellow at RMIT University and former Healthy Livable Cities Lab Director at RMIT's Centre for Urban Research. For more than 2 decades, Billy has studied the built environment's impact on social health and wellbeing outcomes. She has published over 400 articles, book chapters and reports, and has been ranked in the top 1% of researchers in her field globally. We also have Dr. Jonathan Spear, who is the CEO of Infrastructure Victoria, Victoria's independent advisory body, which researches infrastructure issues and advises the government. Jonathan has led Infrastructure Victoria's work on Victoria's 30-year infrastructure strategy, research program, and provision of independent advice to the Victorian government. And we also have Deakin Distinguished Professor Anna Timperio, Deputy Head of School in the School of Exercise and Nutrition Sciences at Deakin University, and Deputy Director at the Institute for Physical Activity and Nutrition at Deakin University. Anna's research focuses on understanding the range of influences on physical activity, sedentary behaviour, particularly among young children and adolescents, including understanding and measuring neighbourhood food and physical activity environments. So thank you again for joining us this morning, and I'd like to welcome our guests onto the stage and look forward to an exciting discussion. Thank you.
Good morning, everyone. First of all, thanks for inviting us, UN Habitat, to this fantastic event. Very interesting. I will start with a personal note, explaining a little bit my experience as citizen in cities. I'm coming from Italy. I've been born and raised in a city called Palermo in south of Italy. Poor public space, no public transport, or very poor public transport. I'm using the car every day when I'm going there to visit my family. I'm using the car for grocery stores, shopping, everything in more than 200 meters far from my place. Then I lived also 20 years or more in Barcelona, Spain, and over there I don't own a car. I am perfectly able to live my life, day-by-day life, not having a car, and we are 4. And then lately, in the last 10 years, I've been living following my duty as staff of the UN in Nairobi, in which it's impossible to live and survive to the city without a car. And we are actually 3 now in the family, and we are planning if only 1 car is enough. So same people, different behaviors, conditioned by the built environment that we are facing. And this is the introduction to the problem and the theme and the topic of the day. So let me also start with who are we, UN Habitat, the Human Settlements Program of the United Nations. We are one of the 2 agencies based in Africa, the Environmental Program and us in Nairobi. And we are doing both things. We are doing theoretical work that we call normative, guidelines, recommendations, technical support in terms of reports and papers for member states, but also through the Urban Lab and through our detached units on the field, we are also doing projects and technical advice to member states on the field. So we have these 2 components, theory and practice. Also, we are the custodian of SDG 11 as UN Habitat, but of course, when talking about cities, we have to look at the 17 challenges and goals that we have, and not only the one that is referring to cities. Also, an important text that I recommend to read because it's approved and endorsed by all member states around the world is the new Urban Agenda, approved in Quito in 2016. And all the principles that we are talking about lately are actually in this small set of articles and this small publication that I really recommend to have a look at. So what is happening in our cities? Apart from the figures that you can see on the screen, cities are responsible of almost 70% of CO2 emissions, Cities are consuming 70% of our energy. Also, almost 80% of water, global water, is consumed by cities. And lastly, also most than 50% of global population is actually, in this decade, for the first time in human histories, living in cities. So for the first time in human histories, there are more urban population than rural. So also cities are responsible of 70% of the global GDP. So on one side, big challenges, but also on the other side, big opportunities. For those reasons, we really believe that all the goals that we have been mentioned before cannot be achieved if we don't tackle the problem of sustainability in cities. But which is the history of cities? We are, since Neolithic, deciding to live together. We are strange animals. We kill each other, but we want to live close with other peoples. We really enjoy the presence of other peoples close to us. So this trend is embedded in our animal behavior. So we created cities, we lived in cities, and with industrialization, we realized that there are some functions that are dangerous for our health, like, for example, industrial areas. So in the 200 years ago, we faced a problem in our cities. That was the air pollution, noise pollution, and all the problems related to industrialization in our cities. Because we are also, in a way, also smart, we decided to change our city, the shape of our cities, introducing some new concepts. A very, very basic one is dividing our cities in zones. One zone for dwellings, one zone for shopping, one zone for industry, in order to separate those clashing environments one with the other. So we invented what is so-called zoning. We also developed further ideas like the garden city, this model of living close to in cities close to the nature, and we enjoyed it. But this model now is becoming absolutely unsustainable. These are images and pictures from different cities around the world. On the bottom, you can see Riyadh in Saudi Arabia. I think on the right, you can see a city in Brazil. And on the left, top left, is a neighborhood in the US. This new way of considering zones is creating low density. We believed in the past that one family, one plot was the model that was more healthy and good for us. We divided our day-by-day functions like working, office space in one place, neighborhoods for living in another place, and we believed that low density, having every family access to a small garden in our backyard for doing barbecues on the weekend with friends, was the most sustainable or prosperous way for our day-by-day life. Of course, those things are not sustainable anymore. We have lack of space. I mentioned that we are mostly, more than 50% of the population is living in cities. We have a problem of space. We have a problem of distances. At the same time, Mr. Ford started to produce cars almost at the same time, and we forgot that cities were for people, and we believed that the car was absolutely embedded in cities. We shaped our cities for cars and not for people in the past century. This is another problem that we are facing. This is something that I spotted on the web surfing in documents. This is a map of life expectancy in the City of London. There are differences of 13 years between one neighborhood and the other, according to different parameters, I guess. The health system is the same city. The distances are not so big, life expectancies can be dramatically different. And this is Melbourne. What is happening in Melbourne is that, as many other cities around the world, adopted this new concept of zoning, division between dwellings, residential areas, and business areas and industrial areas, and is the typical case of a city that will face very soon, is already facing, but will face very soon big problems because of that model. That is not related to your culture. It's a very new thing that we introduce it in our culture. Cars, garden cities are something that we invented almost 200 years ago, so are not really related with our cultural roots. It's just a model that we are applying. What is happening in Melbourne, or will happen in Melbourne, is in the next 20 years, you will have 3 million more population. So we are now at 5 million. You will be, in 20 years, 8 million. Mostly happening in the green area that you have there, where also you have the biggest canopy, tree canopy, that is still there, that is saving you from heat and providing you the environmental resources that you are benefiting. So what will happen? You will have to destroy part of your environmental assets if you want to continue with the density and the model that you are actually using. So a change is needed. There are already some studies that are emphasizing the differences in health between those 3 different areas, because access to services, health services, is not the same. Pollution, air pollution is different. Commuting time, everyday commuting time from people living in the green is different from the persons that are living in the red. So in order to address those challenges, what UNHabitat is suggesting is to have a more compact, connected, inclusive, resilient, and vibrant city. These are the 5 things that we really propose to all member states and all cities in which we are working into. And those are being, 10 years ago, have been shaped and, let's say, captured in a document, in a small brochure, 5 pages, I think, called The 5 Principles for Neighborhood Planning, 2013. Is still available online. We decided, because the differences between cities at global level are so many, we focus on the 5 things that all cities have to do. So space for streets and public space is important. Adequate density is also important. Mixed land use, social mix, mixing people together, so not segregating people for income or cultural aspects, and also connecting people, how to connect people one with the other. Now, 10 years after, we decided to reshape these principles in a more comprehensive document that you can find online. It's called My Neighbourhood. It's a very short document. It's 20, 30 pages max document that is online, and is actually trying to explain to everyone why those principles are relevant for our cities and how can actually change and improve our behavior and our resilience, our sustainability facing the challenges that I was mentioning before. Yesterday we spoke, actually, there was a fantastic session in the afternoon talking about environment and health, and city was coming in the discussion in many ways. So these are the 5 objectives that we propose for the cities of tomorrow: more compact, becoming more compact, increasing the connectivity, increasing the inclusiveness of our city, also through public space, increasing vibrant environments. Yesterday was mentioned how mental health is also important, and of course increasing resiliency to phenomena that are happening every year and actually are increasing every year and will increase, unfortunately, in the next 10, 20 years. These principles are declined at different scales, from the neighborhood scale to the building unit, so are multi-scalar principles. And the document is very easy. We are trying to make our documents really easy to read, user-friendly, in order to explain complex recommendation, complex solution in a straightforward way. So the principles are there. You can find them. I won't have the time to describe all the recommendations that are in the documents. But we have principles, but also tips in order to implement those principles in our cities. The idea is that those principles are not a standalone element, are all interconnected. So you cannot address only one thing. You need an holistic vision of the city and the neighborhood in order to fix it, connecting, for example, public transport with density. We all know, or maybe planners, we know that if you have low density, public transport cannot work, is financially unsustainable, and so on. So we are using this very easygoing document for our own application in planning. As I was mentioning, we are also doing some projects on the field in UN Habitat in countries in which we don't have the technical capacity to plan. And we are using this document in order to steer our proposals. We are also using this as a framework for awareness creation and co-creative process. We are explaining those simple principles to the communities in order to work with them and explain why, for example, we need a more compact and more dense city, something that sometimes is very difficult to understand. Also, we developed a card game in order to engage kids at school and play with the sustainability. So what we will do next, why I'm here, I'm actually proud to be here in order to propose to convert this, at the moment it's a PDF that is online, in a platform, global platform for partnership creation around those principles. I've been interviewing and having bilateral conversation with many of the people that are actually in the room today, and we all see that we have all those ideas. We believe that those are the points that we have to develop, but we are facing problems when engaging with community, explaining to people why they have to leave the car and have to walk. We have difficulties in convincing our decision makers that the strategies are not creating new highways in our cities, but actually rethinking the model. And we really believe that those things can be done, creating a sort of umbrella for partnerships among different actors, from academia, NGOs, municipal governments, institutes in general, labs that are trying to apply those recommendations and innovation on the ground, all together in the same space, so cities can learn from one to the other. So experiences, case studies can be under the same umbrella and can be used by Melbourne in order to demonstrate that something that happened in Canada or in the US that is working well can be adopted and can change the way we are thinking. So this is the idea I want to share with you today, is opening this document, this report, making it digital and transforming it from a report into a platform for experiences and a platform in order to share ideas and convince different levels of our society that those recommendations are very needed. Academia can support with papers. Municipal governance, municipal bodies can support with case studies of things that have been applied, small, bigger, doesn't matter. And so with that, we can actually have a unique place where to share the same vision and the same objectives. I think, for example, we have My Neighbourhood at the moment, but we will launch very soon a My Neighbourhood version for mountainous cities, because we are working a lot in Tajikistan and those Western Asia, Central Asia countries that have specific problems. We can create My Neighbourhoods for health, My Neighbourhood for Australia cities. So we can actually build the knowledge all together, quite easy to do, using the same UN umbrella that we propose. And that was my last slide. Thank you very much.
Thank you very much, Salvatore. If you'd like to join me up here, Salvatore, that would be great. And if I can invite our panel members up as well. Now, Billy Giles Corte is going to run this session with the panel, and I'm going to hand over to you, Billy. Thank you.
Thank you. Is that turned on? Is that working? Yeah, great. Right, well, thank you. Thanks so much, Michelle, and thanks everyone for being here so early. It's great to see you. I think we're going to start with a bit of a response to Salvatore's talk from Anna and Jonathan. So, do you want to go first, Jonathan?
Yeah, sure. Happy to. Good morning, everyone. Great to see you all. What strikes me is the consistency of those core principles that Salvatore's outlined, and its alignment with a lot of the work and advocacy we've been doing in Melbourne, actually. And so we, over the last couple of years, have been doing some work looking at different urban development scenarios for Victoria. And we laid those scenarios out in quite a lot of detail and then modelled in great degree of detail the social, economic and environmental outcomes you get from different urban forms, and really playing around, especially with different levels of sprawl versus compactness. And perhaps unsurprisingly, we come to very similar conclusions to what Salvatore's there in our Victorian context, that more compact cities perform better on an economic basis, on a social basis, on an environmental basis, including health, and also makes much better use of the infrastructure we have, which is, of course, why we are interested in this as Infrastructure Victoria, and saves us billions of dollars in future investment too. So it's really interesting, I think, to see those global principles that Salvatore's outlined and the very close alignment with outcomes we might seek to achieve here in Victoria.
Thanks, Jonathan. Anna, can I get you to respond?
Thanks, everyone. So over the last 20 plus years, there's been a real plethora of research in this area, so it's great to see how this platform has really brought all that together in such a practical way. In looking at the My Neighbourhood tool, there's lots of guidance and principles, but there's a lot of flexibility for local flavour and adapting the actions to the city and the, I guess, the flavour of the city. And I guess that's where research can come in, local research that can help shape that flavour, really understanding what people in the neighbourhoods are wanting, and so that kind of the changes that are proposed can have more of an impact. A lot of my work is focused on children and young people and active living, and so the neighbourhood environment and streets are really, really critical for that, for allowing children to walk and get around, to socialise with friends, for parents to feel comfortable allowing their children to do so. So I really liked the aspect of the My Neighbourhood that really brought in a child focus and child-friendly kind of city kind of aspects. as well as looking at streets or reconceptualising streets from the perspective of people before cars, rather than designing for cars and then thinking about children and cyclists and adolescents and pedestrians later and trying to fit them into the street environment. So thinking about the people first and then the cars second. And I also liked the co-participation kind of aspect of My Neighbourhood and the inclusion of children in that particular focus, because if we can design our neighbourhoods and cities to be child-friendly or through the eyes of a child, it's more likely to be equitable, it's more likely to be appropriate or safe and accessible to someone who's 80 years old, for example. So they're my reflections on it.
And I have to reflect as well, so I will take the stage for a second. I guess when I look at this, it's really interesting. Since 2014, we've had Plan Melbourne, where we've been talking about creating 20-minute neighbourhoods, and that has been evolving over the years. And yet, we're talking the talk, but going from the talk to actually implementation is such a challenge. And our own team in Melbourne has been monitoring through spatial indicators access to livable neighbourhoods, taking into account access to social infrastructure, public open space, and you can see the gaps, the inequities that you're talking about, Salvatore. So I guess what I'd like to unpick during the discussion is a little bit is how we go, through these great ideas, important ideas that are bringing towards evidence, to how we actually translate this on the ground in practice to actually move us forward. In fact, I have a question for Jonathan on that score. You may know, yesterday there was a great report come out on Weathering the Climate about infrastructure investments that are needed in the face of climate change. Infrastructure Victoria has a big focus on reviewing evidence and giving independent advice to government. Now, I'm curious, though, Jonathan, if we're going to bridge this gap between policy, research and practice, what's your advice to researchers about, you use evidence all the time, you know the challenges of using evidence, what's your advice to researchers and also to Vic Health and other funders in terms of us using evidence to help move the agenda forward to actually change the way we build cities?
Yeah, it's a great question, Billy, and I've got to say I've learned a few lessons about this over the years as well, about what doesn't work. So some fundamentals, and forgive me if this sounds trite or obvious, but it doesn't make it any less important or hard, is picking the right questions and answering the right questions. Now, that doesn't sound like rocket surgery, does it? But actually, when it comes to the connection between research and policy making, it's super important and really hard to do well. So researchers and policymakers have got two sides of the same coin to start with. So researchers have a really big opportunity to inform policymakers about, well, what really are the issues? What are the questions? What are the challenges that we should be working on? And how do we frame that problem? And that is actually one of the most important things we can do, is to actually frame what are the problems that we as a society need to be addressing and what's the evidence that that is a problem that needs to be addressed. The flip side of that then is that when policymakers come to researchers and say, we've got a problem and we're defining it this way, the ability of researchers to answer the damn question, right? Now, forgive me if I'm a bit direct about this, but I have dealt with certainly a number of researchers, particularly in university settings over the years, who you'll ask them the question and they'll give you an answer to a question which wasn't the question that you asked, which is all very helpful when you've spent a lot of money and a lot of time not getting the answer to the question that you asked. So, answer the question. Right. Now, that doesn't mean, of course, that researchers shouldn't be pushing back and interrogating and refining the question, but that's super important, right? So those two sides of that, how do we frame the question and helping to answer it. I think the other couple of things, Billy, that there's real opportunities to do is to then be able to put forward what the policy options might be to address and solve the problem. And I say options because one of the really big opportunities for researchers is not to put forward the singular pet solution that people might have, but actually the reality is most of the things we work on are complex problems, and Salvatore's presentation demonstrated sort of matrix nature of that. So being able to put forward a range of policy solutions and the circumstances in which they may or may not work well is really important. And then leave it to the policymakers and the policy process to work through, well, what's going to fly and what's the sequencing and so forth. So I think that's some of the practical ways in which we can really improve that connection between research and policy, Billy.
And what do you think that an organisation like Vic Health could do? You know, it's a funder of research. Is it, you've got any tips for, you know, funders of research to actually achieve what you're saying?
Yeah, well, one of the challenges that funders have when they've got, especially pools of funding and ongoing funding programs, is the targeting of that effort. So being as narrow as possible about what are the problems we're really going to take on, that we really need to have research support in either further defining that problem or the subsectors of that problem and the solutions of that, and rather than spreading it too thin. So and that's hard, right? But that's actually organisational strategy, is picking the problems you're going to go at and keeping going at them until you get a result. And so I've certainly, and this is not a comment necessarily on Vic Health's program, Sandro, but I've certainly observed in other organisations, including where I've been one of the people who decides, you know, what gets researched and so forth, that we can tend to want to satisfy everybody. And in doing so, we satisfy nobody because we stretch our research focus and funds too thin.
Yeah. I'm someone who's worked a lot with policymakers, and I know a good one from a bad one. Not that they're bad people, but, you know, like how hard it is to work with them. And Anna, you do a lot of that as well. You work with local government policymakers. You know, what is it, from your point of view, makes a good policymaker or practitioner to work with? And what tips would you give to them from a researcher's point of view about to be able to do the things that Jonathan's just described?
Yeah, I guess the best part of working with practitioners and policymakers at local government level who are making changes on the ground, the neighbourhood, shaping neighbourhoods, is really about those conversations and the engagement and the continual conversations and engagement to help us better understand the context, what the issue really is, and to really nut down that problem and work out what it is exactly that will that is the knowledge gap that's trying to be filled, and how to do that in the most useful way. So it's partly about what the problem is, what the answer to the question being posed, but also understanding some of the background, I guess, implementation barriers or opposition and other things that might be probably preventing the use of the knowledge that's generated anyway. So one example, for example, could be around, I don't know, the introduction of cycling infrastructure locally. There's a lot of local opposition to that. So it's not just about, well, what kind of cycling infrastructure is going to help, but it's also partly about trying to add aspects to the research that might help solve some of the problem around implementation as well. But all of this takes a lot of time and effort, and on the part of both the researcher and policymakers and practitioners to really understand each other, how they work, and really nut down what that problem is and trying to, you know, be much clearer on what is trying to be addressed and also why.
Yeah, I think those trust relationships where you really get insight into what the problem is really helps to nut the question. Because I don't know if any of you have worked as a consultant, but you often find that when you've got a client, it takes a while to get down to what the question actually is. So it does take time, and that's obviously everyone's strapped for time. Salvatore, you see this all the time, I'm sure, in your work. You know, it's the perennial problem, the gap between research, policy and practice. What can you offer us some insights on how you see we can bridge those gaps?
Yeah, one of the I started my presentation telling exactly that one of the typical answers that I'm receiving from governments at different levels, traveling around the globe, is, Salvatore, we understand your principles, fantastic, but we are a different country. We cannot apply those principles because we are totally different. No, that's absolutely not true. I demonstrated I'm behaving in different ways myself, depending on the context, that the environment that I have in the surrounding, and this due to policies and the political will. No, it's just this. I mean, Melbourne will have, in the next 10 years, to make a decision. Are you willing to invest in highways or in public transport? Are you continuing the model of the real estate of one family, one plot? Or are you willing to introduce new ways of doing it? And this, I mean, my opinion is quite clear on that, on those issues. But that will actually absolutely determine the future of the city in the next years. And this is something that is political, it's related to the community, so we have to actually work a little bit with communities in order to introduce those difficult concepts at all levels, for example, starting from schools, in order to influence decision makers in the right direction. I think we all in this room, we understand the complexity of the problem, but the problem is politicians have to win elections every 4 or 5 years, and to change the mindset, totally the mindset is quite complex for them. So we have to support them in taking the right decisions and write the right policies. Yeah, this is. I would say that Melbourne is not. I mean, is an advantage case. I'm working in countries in which, I mean, that have no technical mean to address the issues. I was reading a paper that is demonstrating that Lagos in Nigeria in 70 years will be the most populous city in the world. Lagos. We are working in countries that have one planner for 5 million population. I mean, Melbourne has the potential to, and many cities in Australia have the potential to change policies and to go in the right direction. So, yes, this is my answer. Trying to address the issue at different levels, from decision makers to the kids, throughout all society at different levels with different means, and with the partnership of all actors that are mostly present in this room, in order to have a sort of focused approach to those problems, and have a sort of coalition or synergetic way to address the policies of the new city that will come. And lastly, some examples. For example, in Vienna, I was mentioning yesterday to someone, Vienna, 60% of the population in Vienna is living in affordable social housing. This is a policy. And this is changing the quality of life of these people. 60% of population in one capital city in a healthy country in Europe is living in affordable and social housing. And this requires policies. This is based on policies, on strategies that have been took years ago. And the same city, the cost of one day public transport ticket is $1. Yeah, I mean...
And I mean, it's interesting in Austria because it's actually, in Vienna, it's actually good quality public housing. It's not poor quality, and it's not high rise. It's sort of medium rise, 10-storey maximum, open space. It's just a different way of thinking, isn't it? And it's a real opportunity. I mean, I'd just like to raise with you, you've raised some really important questions about the really role of the public and how we deal with this, because as you say, politicians will only do what the public wants. They want to get re-elected. And now what we have, I don't know if you've seen the pushback around the 20-minute neighbourhood. People are getting worried about that this means it's a conspiracy, that people are going to be locked down, and the reason why we're going to have a 20-minute neighbourhood is so that the government will require people to stay at home. Carlos Marino, who's developed the 15-minute city concept, has been getting death threats. I'd sort of like you to respond. I mean, how do we manage this? Jonathan, have you got some thoughts?
Yeah, I do, because I have a lot of thinking about this. And let's maybe start with that example of people who think that 20-minute neighbourhoods are designed to control the populace and what we think and so forth. So in any policy area, there's always going to be a proportion of the population who've got some pretty wild views that you're never going to change. And that's just how life is, and we saw it through COVID, we saw it through lots of areas, right? I'd suggest to you that that's not where you need to be focusing your efforts. One of the dilemmas we have in lots of areas of public health and public policy more broadly is that we know what to do, that we know what the technical solutions are, and Anna and Salvatore have been talking about that. It's how do you then create the conditions under which incremental implementation of those solutions is something that the public, politicians and policymakers will get behind. And that's multifaceted, right? And some of it is about being in the media and advocating, or talking to ministers and advocating, but what sits behind that? So one of the big challenges in making change is that those who have anything to lose are the ones who will speak up. Those who have things to gain tend not to. Sometimes because they don't even know they have it to gain. Because, for example, in a lot of the areas of city planning, the people who have something to gain are not even here yet. Some of them aren't even born yet. So it's probably not fair to criticise them for not speaking up. But there's also, an ability then to think through and talk to people whose voices might not otherwise be heard. And so actually focusing research efforts on capturing what do people think about how they do want to live, and under the conditions under which change might be acceptable, rather than it being a yes-no kind of proposition. But that's important. So we've done some work that's sort of on the more deliberative side in a number of areas where it's hard policy change, and one we did was about what does density done well look like to you? So not do you like density? Yes, no. Should we have more growth? Yes, no. But rather, we talked to a really mixed group of residents who'd lived through change in Melbourne in different suburbs about what does good density look like. And they were able to tell us both the conditions and what they really valued, and it was good quality design, open space, public transport, and a bunch of other things too, but they were the top three. But also really interesting debates between members of the community who we're talking with, who are actually challenging each other about fixed views, about whether the barbecue and the open single plot kind of approach is what the future is. So bringing that kind of research to bear is helpful to underpin the conversation then with policymakers and the media when they say, oh, we could never do this, no one will accept it. And it's like, no, that's not the case. Here's the evidence.
Yeah. Anna, do you have any, research about children, about what they're wanting? Do you have insights about what kids are after?
Yeah, we do. We've also done a bit of research, like Jonathan was saying, around the kinds of changes around schools that parents would find acceptable in terms of increasing safety around schools and reducing car dependency, reducing traffic congestion around schools as well, which can feed into this argument around, people are actually wanting change, parents are wanting change. So that was one point I would make. We've done a lot of research around public open space and what children and adolescents, older adults, all age groups would like, and in terms of encourage them to visit open spaces, be active in open spaces, and also just be social and interact with other people in open spaces. So that could be used as well. So we've got lots of research, if it's framed appropriately, can be used to advocate. And I see a role for bodies like Vic Health in trying to change that public perception out there. There's lots of examples around Melbourne of, for example, I'll say it again, the cycling infrastructure that has gone in and come out or has been planned and then has been shelved, partly because of public opposition. So I think it's a really important step if we're going to reshape our cities to try and change that social, change the prevailing views that are out there. And like Jonathan, I think it's the people who are on the fence that we can shift. And, you know, there are pockets of people that won't change their opinions, I guess. Yeah.
I guess the thing is, it's like the squeaky wheel. We hear a lot about the squeaky wheel. The media wants to pick up on that message, and so we hear that. We don't necessarily hear the silent majority. And good evidence is great for that in terms of... Salvatore, what have you found across the world when you're in your travels?
Yeah, no, I've been, for example, one example is I've been working 5 years in a project in Saudi Arabia that is facing quite in a totally different environment, of course, but facing similar problems. And is one of the places that where they have a sort of different lifestyle, if I can say that. And they are really willing to preserve the space for the family is very important. So they don't want now to live one on top of the other because they want to preserve privacy in their lifestyle. So when I was going there and saying, okay, we have to be a little bit more compact because these cities that you are building are a monster. And yes, of course, you are producing all the fuel that you want, but you will have other problems. Obesity is quite a big issue in this country. So in order to unpack it and try to solve the answer, Salvatore, you are right. These principles are fantastic. We fully understand, but I mean, we are another animal. We cannot do it because we are so different from everyone else. And this is an answer that I'm receiving everywhere I'm going. I decided to do a project with female university students of architecture and doing a neighborhood with them in the school. So I modified a little bit the project. Let's not talk about principles. Let's find with you which are the principles that you want in your neighborhood in order to live there as a planner, female planner and architect. And at the end, this thing of the privacy was really not so important for them after 2-3 days of workshop together. And they raised, look, I would like to actually, I prefer not to use the car every day and having a grocery store close to my house rather than be totally screened from and have my own privacy. So we discovered together that this thing of privacy was just a sort of something that real estate, probably, I don't know who, but something that has been created but is not in the culture of these people. So I don't know, we have to really start, for example, density. If you go to an audience of practitioners and talk about we have to be more dense, you will lose the battle because density is not nice. But if you explain to a kid that instead of having a basketball net, and if we take out this space in the backyard for the basketball net that he has, and you will have a basketball court very close to his place where to play with the kids, and possibly riding a bike safely from his place to the other, possibly he will decide, okay, maybe it's better the basketball court than the small space that I have in my backyard in order to play alone. There are different ways, but I would say we have to a little bit address different sectors of the society in the right way in order to make those recommendations and principles digestible. Also, decision makers. I mean, you have to we have to create the evidence for Melbourne decision makers that building new highways is not the solution. It will create more problems in the future. And we need academia to explain to them with facts and figures that possibly it's better to invest the money in a different place and not in this kind of infrastructure.
I think we're also lucky that we've got Infrastructure Victoria, who is pushing exactly that agenda, and that's their job, is to actually advise government with evidence, which is great. I'm going to wrap up now because we're at the end, and I'm going to hand over to Michelle. But I think we've emphasised some really important issues. Goal 17 for the SDGs is about partnerships, and none of this is going to happen without partnerships. Partnerships across government, because we're going to build cities, we need to all the government departments working together, but also vertical partnerships with the community clearly is critical, and all levels of government and the private sector. Everyone needs to work together. This is a big agenda. I think in terms of the design, just wanted to pick up on one thing about, Jonathan talked about the work that Infrastructure Victoria has done on getting density right, or what's the term?
Density done well.
Density done well. I call it delightful, livable density rather than dreadful density. But I think, if we get the density wrong, we don't honour and we build things to a standard that does maintain privacy, noise. It's going to produce problems that will actually get in the way of us actually changing, doing the things we need to do. So I think there's a real requirement that we have the standards in place to build good outcomes for people so that we don't end up with, problems in the future. So it's a really critical thing. I'm going to hand over now to Michelle, who's going to wrap up.
Oh, thanks for facilitating that session, Billy, and what an incredible panel. Thank you very much for sharing your wisdom and your expertise with us all today. Very much appreciated. I'd just like to share a couple of takeaway messages that I heard with you all. So first of all, it is really clear that cities are fundamental to shaping the environment and that the environment really impacts on our health and wellbeing. The role of researchers to help define the policy problems is important, but also when the policy problem is defined, we need the researchers to inform the problem solving, and that sort of lead into implementation. Let's go beyond the problem and let's have a look at the how. Let's benchmark, let's monitor, and let's implement. And using our researchers to solve implementation barriers to change, noting that it takes a partnership to do this and gaining the trust between researchers and local government. And if we can do that, I think we'll have a better city and environment for us all. But thank you, everyone. Very much appreciated. Round of applause for our panel. And just lastly, we will send the Slido contributions out to you later on this morning. Appreciate your attendance. And one plug, please. Let's have a look and check out the misinformation-itis impact of tech on health this afternoon. Thanks, guys. Bye.